Good evening. My name is student clinician Tyrone Bird. Today I'm going to do a demo of some ankle and heel projections. So let's go ahead and get started. We're going to do 3 ankle projections, 2 heel projections, and we're going to go ahead and take it down. And this is going to simulate our image receptor. Typically, all these images will be at 40 SID on a 10 by 12 cassette. So first image we're going to do is a AP ankle mortise. So we're going to ask our patient to extend their leg. Then we're going to ask him to dorsiflex their foot. Now with ankle mortise, you're going to ask the patient to rotate medially 5 to 15 degrees. And we're going to have the central ray perpendicular to the ankle joint, midway between the 2 malleoli through the center of the film space. And you're going to collimate to include the ankle joint, the distal tibia and fibula, and the proximal talus. We're going to ask the patient to don't breathe and don't move as far as instructions for breathing. Next is going to be medial oblique. Now it's going to be same thing. Patient extends the leg. We're going to ask the patient to dorsiflex the foot, and then we're going to have them rotate internally 45 degrees. Again, 10 by 12 cassette, 40 SID. Central ray is going to be perpendicular to the ankle joint midway between the 2 malleoli through the center of the image receptor. And we're going to collimate to include the lateral malleolus, distal tibia ankle joint, and distal tibial fibular joint. Again, we're going to ask the patient to don't breathe and don't move. Now the lateral image, we're going to ask the patient to extend the leg and then laterally rotate the foot, ask them to dorsiflex. Again, 10 by 12 image receptor, 40 SID. The central ray is going to be perpendicular to mid ankle joint through the center of the film, and we're going to collimate to include the distal tibia and fibula, the ankle joint, as well as the talus and the calcaneus. So those are our 3 ankle projections. Next is going to be our heel projections. Oh, again, and don't forget to tell your patient to don't breathe and don't move. So the heel projections, there's 2 of them. There's going to be AP semiaxial. So again, we're going to have the patient extend the leg, dorsiflex the foot, 40 SID on a 10 by 12 cassette. Now here, central ray is actually going to have a tube tilt of 40 degrees cephalic. So tube in the central ray will come down 40 degrees cephalic to enter in at the base of the 3rd metatarsal through the center of the film. And we're going to collimate to include the calcaneus from the tuberosity to the sustentaculum, and include the trochlear process. Again, we're going to ask the patient to don't breathe and don't move. Lateral heel is going to once again have the patient extend the leg, laterally rotate to the affected side. So in this case, it would be the right. 40 SID 10 by 12 cassette. Central ray is going to be perpendicular to the image receptor about 1 inch to 1.5 inches below the medial malleolus, and we're going to collimate to include the calcaneus. Again, we're going to have the patient don't breathe, don't move. This would be the right leg, would be the infected leg, and we would place our marker for all the images and all our projections on the lateral side of the image receptor. So those are our views for ankle and heel. Thank you and have a good day.